Hi, my name is Renee Robinson, coming to you today on behalf of FinancialJuneteenth.com. So yesterday, one of my friends on social media posted an article that really bothered me. So the Miami Herald did an investigation to see why thousands of children were eliminated from the state's healthcare system, and it should be noted that these children are special needs children. So, like I said, Miami Herald did the investigation, and the article was written by Carol Miller. Now, you may wonder, why did Florida cut health care to special needs children? Well, they cut the insurance to the children to what? Save money. That is one of the oldest BS excuses that governments use when they want to eliminate service from poor people, from disabled people, and quite frankly, people that they don't see a value in. So what they do is they scare the general public with these, oh my God, we're in a deficit. Oh my God, we're going to have to raise taxes drastically. Oh my God, we can barely pay our bills. They use those tactics to really get into the heads of taxpayers to make them believe the hype. And I can honestly say that if you live in a smaller community, that may be true. You know, smaller communities sometimes have challenges of generating revenue or limited vehicles to generate revenue. So if you live in a smaller community or county, that may be true. But if you live in a large metropolitan area or a large city, 9 times out of 10, they are not in a deficit like they try to promote. 9 times out of 10, they have money. And I'm saying that as someone who has worked in government on the tax revenue end, who has seen money come in the door, who has sent people tax bills, who has negotiated delinquent tax bills. So I have seen revenue, come in. I have looked at budgets to see where money was being spent. So I can tell you that oh my God, we're broke, that's just some bull crap that they are pushing to you, and don't believe the hype. Also, I would encourage you to get a hold of the local government where you live. Get a hold to their budget. If you don't know how to read it, look for online resources that will explain it. So you can see where the money is being spent, because quite frankly, that money is not theirs. That money is yours. That money is mine. And they should be good stewards of that money. Now, a lot of times what they do is, in fact, use a chunk of that money to feed into the prison system, to feed into these BS projects, to so-called fund economic development, which is basically gentrifying most of this country. But don't believe the hype into, we're facing a deficit. Don't believe it, because if you live in a larger city, that's usually not the case, because they have a ton of vehicles to generate revenue. So back to the article. Parents were surveyed, and based on their answers to specific questions, that's how their children were eliminated from the state healthcare plan. And like I said, 9,000 children were affected. Now, 2 of the children that the investigation focused on was the 6-year-old boy who was blind, who has very limited vision in his left eye, but basically he only reads through Braille. And then his sister, who also has similar issues with her vision, she can only read through the use of a magnifying glass. And as someone who has recently had to help a family member access an eye specialist, I can tell you that certain specialists like eye specialists or cornea specialists or any of these other specialists, they are few and far between. You don't find these people all that easily. If you live in a smaller community, they're even harder to access. If you live in a larger city or a larger metropolitan area, a lot of times these doctors are located in the suburban areas, and they are not within, let's say, a 5 to 10 mile radius of where you live. So Access to these doctors is vital so patients can get the health care they need, and also so they can maintain the health care that they have, so they don't, so their health care or their health does not diminish. Now, according to a 2011 law, Florida's healthcare model went from a Medicare model, which is basically free insurance for those that qualify, to a state managed fund with a cap. So basically what that means is the state of Florida set aside a certain amount of money for that healthcare system or that healthcare insurance, and once those funds have been depleted, then that's it. So if you needed to get access to that healthcare and the funds were almost diminished or the funds had been depleted, then you could not get any sort of assistance. And basically they leave it up to the insurance companies and the healthcare providers to divvy up that pot of money. And I don't necessarily know that that's efficient. More than likely it's not. So 2 ways that parents could be eligible for the state's insurance program is, one, which was to qualify for Florida's Medicaid program, Medicare program, or to qualify for Kid Care, which is a subsidized insurance that if you make too much for Medicare, then you could qualify for Kid Care because you don't make quite enough money to buy a third-party insurance either through a private source or through your job. So in December of 2014, a federal court judge called the state's medical program out because he said it left poor children basically with second-rate insurance, basically leaving them high and dry, like, oh well, figure it out for yourself. And I'd like to add that he also stated that their insurance violated federal law. It should also be noted that Florida at the time had a surplus of $635.4 million. Again, at the time, Florida had a surplus of $635.4 million. Now, that's not anything to sneeze at. Like, that's not chump change. Also, Governor Rick Scott was proposing $1 billion in tax cuts. And basically, if those $1 billion were taken out of the state budget, it was going to reduce health department jobs by about 718. And that's also problematic because if you don't have enough personnel to actually help people access services, and that also impacts people's quality healthcare that they receive, and also it impacts whether or not they can even get into the healthcare system to get whatever they need out of it. So it's interesting. I don't live in Florida, but I read and hear a lot about Governor Rick Scott, and I just wonder if maybe he had a special needs child, if he would see the value in this insurance for many families even families that are well off, because their children need, these a long list of specialists and also in some cases medicine. They really can't afford to just pay out of pocket. So I wonder if Rick Scott was in that same situation, would he get it? It's a good chance that he wouldn't get it, but it's just interesting that he can be so, just so closed down or just so shut off to that being a necessity. I also find it highly hypocritical that a lot of health departments, which are usually run by counties or local government, on the one hand, they will say, oh, we want our citizens to be healthier. We want them to live longer lives. We want them to go get preventative health care. We want them to go get their wellness checks. But they consistently cut funding for health insurance and other social programs. So they say one thing and do total opposite consistently. And this is not limited to Florida. You can probably find this reflected all over the country. 9 times out of 10, this is consistent, but it's clear that we do not value healthcare. We do not, because we're not putting our money into it. And people that cannot access healthcare also pose a health risk to the collective of the population, because they're not getting the medicine they need. They're not being seen by the doctors they need to see. And that's also a risk to themselves as well. And they can't live a quality life. And in a country with so many resources, there is no excuse for this sort of foolishness. It's just no excuse. I think we have to demand better of our governments. We should. Because let's think about this, and let's remember that they are spending our money. They are spending your money. They are spending my money. It is not their money. And they need to be reminded of this. So, thank you again. Thank you for listening. Again, my name is Renee Robinson. I hope you enjoyed this. And until next time, have a good one.